name's Lisa Orloff, and I'm professor of otolaryngology head and neck surgery and director of endocrine head and neck surgery at Stanford University. I'm also the current chair of the American Thyroid Association Development Committee, as well as a member of the Surgical Affairs Committee for the American Thyroid Association. In this video, we're going to discuss medullary thyroid carcinoma and what the American Thyroid Association is doing to help promote research, education, and optimal patient care for those with medullary carcinoma. You will hear some patient stories and what you can do to help further the mission of curing medullary carcinoma.
Hello, my name is Manisha Shah. I'm the professor of internal medicine at the Ohio State University Medical Center. I'm a medical oncologist and a member of ATA. I also was involved in the ATA medullary thyroid cancer guidelines that were revised this year. Medullary thyroid cancer, as you might know, is a rare type of thyroid cancer. However, medullary thyroid cancer starts in thyroid, but it can affect many organs such as liver, lungs, lymph nodes, bones, and you name it. So patients who are struck with this diagnosis suffer from many different symptoms, including diarrhea, flushing, as well as the organ dysfunction and ultimately organ failure. So patients actually die as a result of medullary thyroid cancer diagnosis. And today I have Dwight Vicks, who is a family member of a patient who was diagnosed with medullary thyroid cancer. Dwight, would you share your story with us?
Thank you, Manisha. My name is Dwight Vicks, and my wife Jean was diagnosed with medullary thyroid carcinoma in 1999 and was on that journey for 13 years, had 7 surgeries, participated in 2 clinical trials, as well as some cytotoxic chemos. So thankfully we had some wonderful treatment from phenomenal physicians that helped her get through that journey as best as possible.
So ultimately we lost Jean.
We did.
But she's still here because what you and many others are doing to improve the care of patients with thyroid cancer. So Dwight, would you tell us about some of the challenges during this decade-long journey?
I think the first biggest challenge was determining what she had. Mm-hmm. And we were very fortunate that we had an FNA at upstate in Syracuse that got the diagnosis right. Okay. And once we discovered it was medullary thyroid carcinoma, we knew it was rare, and we started doing a lot of research. Mm-hmm. So then the question was, who treats it, who sees the most of it, so we could get the best physicians on her case.
So you had to do the homework yourself?
We did a lot of it ourselves. We're both blessed with a good education, but we also relied on some key physicians to guide us. When Jean was diagnosed, she was 37, and we have 3 children, and our twins, Sarah and Dwight, were 2nd grade, and Emily was in kindergarten. Huh. And of course, when you're faced with a major health challenge, you also have to take care of your family. Mm-hmm. And thankfully, we had a family that could step in to watch our kids while we were off getting our medical treatments, which in both cases were 5 hours away. We went to New York City as well as Boston for her numerous treatments. Mm-hmm. Mm-hmm.
So at the end of the journey, we still lost her, but I hear that Jean had great attitude about how she went through this journey. Can you tell us a little bit about that?
Yes, she was an extraordinary woman. She always looked for a silver lining, and when she was diagnosed, she said, how are we going to solve this? And she was a great athlete. She played field hockey in college, and so when she would prepare for her surgeries, it was like a big game. Wow. And then when they discovered that the cancer had metastasized on her lungs in 2001, and this was after the 4th surgery, there were no systemic therapies at that time. So her concept was to create a dream team of the best physicians in all the different disciplines that deliver cancer care to come up with some clinical trials for medullary, because there were none at that point. And she was the inspiration of a group called International Thyroid Oncology Group, of which many ATA members are a part of.
That's great. That's great. So at the ATA, we're trying to work very hard on improving the lives of patients and the longevity of lives of patients with medullary thyroid cancer by doing research initiatives, doing education, as well as to improve and develop the guidelines for treatment of medullary thyroid cancer. So thank you very much for considering donating to this important cause.
I'm Steve Sherman. I am a physician who specializes in the care of patients with thyroid cancer, particularly medullary thyroid cancer, and I've worked with the American Thyroid Association for many years on its boards, in various committees, and in the development of treatment guidelines for patients with thyroid cancer. What we've heard so far in this video is a great deal about medullary thyroid cancer, the symptoms, the problems that patients and their families can have with this disease, and the particular and unique problems that they can face when we talk about inherited forms of thyroid cancer, which are quite special to medullary cancer. What we've seen is that there's a great deal that needs yet to be done. Part of that effort has been the devotion of the American Thyroid Association to improving the quality and the standard of care for patients with medullary cancer throughout the United States and around the world. One of the most important parts of that effort has been the development of high-quality, consensus-driven guidelines for the treatment of patients and their families. This has been an effort that's been ongoing in multiple forms of thyroid cancer by the ATA for many years, but in particular, the guidelines for medullary thyroid cancer have been recognized worldwide for their impact. These are efforts that require a tremendous amount of support, and we've, through the American Thyroid Association, are so grateful for the donations and the philanthropy that has helped to underwrite this. But this is an effort that has to keep on going and needs to expand. And so we certainly welcome and look forward to donations that can be made to the organization through our website at www.thyroid.org, through multiple other mechanisms, including by phone and by mail. And we certainly would appreciate any contributions and support that can help for this effort. Again, I'm Steve Sherman. As an endocrinologist and as a proud member of the American Thyroid Association, I thank you for your interest and your support.